I'm the consumer reporter for Local 12, and today I have the pleasure of exploring holistic benefits and how that actually will cut down your doctor's bill in the long term. And guess what? You can do it right here in Evendale with Anchor Wellness that is about to have their grand opening. And I get the pleasure of sitting here with Sarah Crawford, who is the owner, the brains behind this whole business plan that she made several years ago and is now finally coming to fruition. And Sarah, tell me, I mean, people think holistic, people don't really understand holistic care, so maybe you can start with that. Mm-hmm. And then, why is this good for your wallet to start here?
Yeah, so holistic just is whole body care, right? In medicine and the human body, we really can't, dissociate the two, right? So we are a collection of like-minded health and wellness providers, many of us medically licensed, board certified, and we also have movement specialists. And we built this place to support individual entrepreneurs who wanted to do things a little different than what the systems that they were currently working in. But also we wanted to improve how consumers access care and find highly efficient care. Okay. So you and I were talking earlier about typically you go to the doctor and then they send you somewhere and then they send you somewhere else and then they send you somewhere else.
Exhausting.
And you have to call and make the appointment and you have to get your pre-approval from your insurance and then you have to tell them what was going on and then you got to do the same thing again. And 6 months later you're on to the second provider. And that's not health. That's not healthy. When people are motivated to do something, what they need needs to be available.
Yeah.
And they need the highest level of that knowledge available. And so that's what we're looking to do, is just gathering these really specialized providers so that individuals don't have to bop around town. They don't have to be put out trying to make their appointments. They don't have to go to 6 different places all in a week. Yeah. Right? So like at the Anchor Wellness Center, you can get your physical therapy, nutrition, strength training all within 2.5 hours in one place and not have to come back for the rest of the week.
Which is amazing.
Yeah, so we're trying to just improve the way people live, make it more efficient and effective so that it's sustainable.
The other thing that I hear from my friends is they're like, why do you spend so much money on doing this and that? Because I really do try to take care of myself. And it's not because I have all this money. It's because I'm trying not to spend money in the long term for bad health decisions. Right. Because I have had rotator cuff surgery, and that's really expensive. And I could have stopped that if I had had more knowledge that holistic care isn't just for people with lots of money. Yeah. And tell me, there's actual cost benefits if you choose someplace like here, Anchor Wellness, to learn how to take care of yourself. So explain that to me, because you have the wisdom, because you work in real healthcare and you know the cost of insurance.
I think primarily what people need to understand is when they pay their insurance, you pay a monthly fee, right? And that's to have access to your insurance company. Yeah. Your insurance company goes around and negotiates rates with different providers that say, I'll pay X for this service. And then you show up to get that service, and the insurance company is going to review your diagnosis, a bunch of things on paper, right? They're never going to meet you. They're not going to know if you have children, what your work life is like, what your home life is like, if you're a single parent. They don't know any of these social determinants that impact health. Yeah. So they make decisions and they decide what they're going to pay for. And then they decide to pay the insurance, or the provider, a little bit of money, and then you get charged the rest. Yeah. And so what the providers do to try and get paid the amount that they need to justify the cost of labor and billing and the operations and all that is they inflate the cost. And so at the Anchor Wellness Center, we don't have to pay the middleman. Right, our providers, all of our providers are out of network, which always sounds really scary to consumers of healthcare services up front. But I can tell you, like in my physical therapy practice, we see patients on average 4 to 6 visits. In a traditional insurance-based practice, in this area, it's 18 to 20 visits per plan of care. So when you look at our costs that are sometimes a third of what an insurance-based provider is charging over 4 to 6 visits compared to 18 to 20 of your copay co-insurance, your just out-of-pocket costs are almost always cheaper. Yeah. And the other thing is that people think that they often are getting, like physical therapy, for example, for free, but they're getting billed 30 days later. Yeah. Some insurance providers will cover it, but nutrition therapy, not often covered by insurance unless you're diabetic. There are some other diagnoses that are covered, but there are piles of scientific studies that show healthcare savings when working with a dietitian to prevent cardiovascular disease, diabetes, obesity, all these different, again, comorbidities that cost more later on down the road.
Right.
Health coaching. I think a lot of people are unaware of what health coaches are. Health coaches are these phenomenal sources of information. They are not licensed, medically licensed providers, but they typically have, the ones that work in our network usually have at least 2 years of training. Most of them have come out of medicine in some way, shape, or form, got burnt out by working in the discipline they were working in.
Right.
But they are these people who are advocates, right? They save you from having to search Google. They save you from having to pop around to all the different people to figure out what's going on. And they just help streamline care. And if you go to your physician's office for your physical, and your doctor says, look, your cholesterol's high, sounds like you're really, really stressed, let's put you on this statin, but I need you to lose weight. And you walk out the door. Then what?
Yeah.
Right? And you might not need medical nutrition therapy like a dietitian, but a health coach can just help keep you accountable. We should be able to teach people how to take care of themselves and it not be dependent on healthcare and on drugs all the time or on surgeries. And don't get me wrong, there are times when those things are necessary. But we're going to try and help people figure out how to help themselves.
I don't know if everyone's caught on yet, but you can do everything in this space. Like all of the experts are talking to each other here, right here. They're not telling you, you're gonna need this specialist, and then you have to go out and figure out who that specialist is and where to find them.
Right.
So talk to me a little bit about all the things you're gonna be providing here.
Yeah, so right now we have physical therapy, nutrition therapy, massage therapy, health coaching, strength training, yoga therapy, Pilates rehab, and mental health.
Oh my.
Yeah.
And you know all these people personally.
Yeah, absolutely.
On a personal level, or have worked with them.
And that's just in our network, and we have a ton of providers outside of our network that we are just as communicative with, that we have just as strong relationships with, that have a lot of the same philosophies.
Yeah.
So, I'm dealing with this situation currently with my own family member who was in the hospital, and I asked one provider to talk to the other provider, and the answer was why.
Because communication.
I mean, we are complicated beings, and all of our systems work together. And when consumers feel like they have a team behind them, they immediately get better. Like when they know that their people are talking, they immediately get better, right? When they don't have to be the historian, they immediately get better. And so that was really the point of the Anchor Wellness Center, is to try and make a little mini system like we have here in town, but cut out the bureaucratic red tape so that we can communicate with one another.
Yeah.
And we can give the highest level of care from the highest, most specialized providers without having to, silo ourselves because we're overworked.
Right.
So this idea came about to create community for entrepreneurs who are feeling like they're in a rut, who are feeling like giving in and moving on and finding a new career. So I wanted to create community for entrepreneurs who had a philosophy of doing things different than the way it was being done, but also for individuals, right? Like I mentioned when we started, there are 5 main pieces to health, and that social one is huge. And if you've got a friend that's going to come with you to work out or meet you at Pilates, or you guys share the same physical therapist,
right? They're more likely to come.
Yeah, exactly. You are. Like if you've got people who invest and value in the same things as you, it makes it easier, and you want to do it.
Right.
It doesn't feel like a chore. And then the other thing is that those same people tend to do a lot of preventative care, right? And they do a lot of their own maintenance and self-care. And I think, we do it for our cars, we do it for our homes.
Yeah.
And we do it for our kids, right? Like I tote my kids off to all their appointments.
Yeah.
So we just need to start doing it for ourselves.
Yeah.
And it's easier when you can, create community and have people to do it with.
Well, and there's so many medical studies out there. They're always changing. I get confused sometimes on what's actually good for me, because at the end of the day, and I'm sure you can steer me wrong if I'm talking out of turn, but like everybody's different. Everyone is different. Lifestyle, the way I metabolize things is going to be completely different from maybe what this one medical journal says the majority of people are like.
100%. Yeah, I mean, 95% of diets fail. Scientifically, we know that. Metabolism, there's a lot of sort of mistruths out there about metabolism. Dr. Cindy Castle, who's one of the dietitians inside of the Anchor Wellness Center, has a PhD in exercise science and a master's in nutrition. She can talk metabolism until she's blue in the face. But she has educated me to know that like our metabolism doesn't naturally slow. It slows like 1 gram per something or another per year.
Mind blown. Did not know that. Okay.
So what do we need to keep our metabolism? We need muscle. Muscle burns fat, right? So a lot of the reasons that we see weight gain in later life is because we just stop moving, right? We stop moving, we stop moving against resistance, and we lose muscle mass. So you know that's the interesting thing. There's a lot of noise out there. There's a lot of noise in the integrated healthcare space, and we really pride ourselves on just kind of really whittling it down to like the basics.
Yeah.
You know, health care and self-care doesn't have to be expensive. It doesn't have to be complicated, but you do need to know what is important and relevant for your body.
Yeah.
It will not work. The same plan will not work for every single person who walks through the door.
Right. What is your advice to someone struggling out there that may just be like feeling some aches and pains or like can't quite get to where they want to be in their health journey? What are some things you suggest they start on that, you know, maybe are cost effective or they can
start
do?
simple.
Yeah.
Start simple. I mean, we have this conversation all the time. You don't have to move mountains, right? To get to where you want to go starts with one step. And I think if I could rid the world of diets and restrictive diets.
I know, I hate the word diet. I'm an intuitive eater, so.
Yeah, it's paying attention, right? It's being aware. So that's where we tell people. We tell people that who are struggling with pain. We tell people who are struggling with body image, with nutrition, with a professional goal. Rome wasn't built overnight. So first start by giving yourself grace and that you recognize that there's somewhere you want to be and that you don't have to get there overnight.
Yeah.
And typically getting there overnight.
Local 12 has more consumer stories just like this. Don't forget to click the links and press subscribe.